My name is Lucian Panait. I am the president of the Minnesota Hernia Center, and I am a general surgeon myself. But many of us have a passion for the hernia field, and we specialized in this narrow field, and we try to stay up to date with the latest developments in techniques and technology. We need to individualize the mesh options to the patient's characteristics, the size of the hernia, their associated medical problems, likelihood of future pregnancies or future operations in some of them. There are a few categories of patients who may benefit from a resorbable mesh rather than a permanent synthetic mesh. Women who desire future pregnancies, but yet they have a hernia that is very symptomatic. Maybe patients who have a hernia, but they are likely to undergo another operation during the course of their lifetime. There are other types of patients who are completely opposed to having a synthetic mesh inserted. Most of the meshes that I use in my practice, and I think many hernia surgeons use nowadays, are macroporous. Why are this important is because these large pores allow for tissue deposition and formation of newer blood vessels in between the pores of the mesh, allowing for easier integration into the tissues. The Transorb mesh has grips on its surfaces. This is called ProGrip technology. These grips act similar to Velcro, and when placed onto the tissues, they stick just enough to allow the mesh not to shift from where it was initially placed. However, the grips allow the mesh to be repositioned if it was not perfectly placed. The second, this full contact between the mesh and the tissues allow for easier integration, deposition of our own cells into the pores of the mesh. The mesh is very soft and pliable. We do not want to insert stiff meshes into the body. So having a mesh that is thin and pliable and macroporous, that I think is the best possible option. When doing preperitoneal repairs, I like to place the mesh with the grips facing anteriorly, grips facing up, so that they come in contact with the fascia. And allow for integration. However, one of my preferred methods of fixing hernias, and especially for medium-sized hernias, is the retrorectus repair, the Reeves stop operation. I particularly like this repair because it allows us to create some musculocutaneous flaps that decrease the tension on the closure, and also allow for mesh placement in a very highly vascularized space, which is the retrorectus space. I have been very happy since starting using Transorb into my practice. My patients have had great results. They are overall very pleased. They recovered well.